ways for you and your employees to access healthcare. And every time we show RedPeg how they can save money, it gives you an opportunity to give away free healthcare, give away free drugs to your people. And that allows you to stand out from your competition, attract, retain top talent, because all your competitors today are using those plans sponsored by the national insurance carriers, and they're all the same. Every plan's very similar, and every year members' cost share tends to go up over time. So today, if we do our job right, hopefully you'll understand that there is an alternative way to do all of this.
Appreciate it, John.
All right. Before I move forward, do you have any questions for me about Blade Consulting or anything I've said so far?
No, I'm good with Blade. Obviously, you understand the pain point for anybody considering changing plan.
Sure.
Is not just at my level of organizational level. The pain of that comes down to our employees and having to consider changing their doctor is something that I never want to do. I mean, it's hard to even consider doing that to my team. So that's a big challenge. And so got to be a very compelling reason to make that change for us.
I understand. Much of what we're going to talk about today is about your member. It won't be about cost. It's going to be about how we can create that better member experience. Okay. Before we get started, so I can best. All right, can you hear me?
I'm back.
Right. Before we get started, so I can tailor the balance of our conversation, can I ask you a couple questions, Brad?
Sure.
RedPeg?
Yep.
Off the top of your head, do you know how much you're spending on your premium right now? Ballpark?
Oh my God. I don't have the number off the top of my head. I'm sorry.
Okay. Have you ever discussed, or when's the last time, or how often do you discuss alternative strategies, or what I'll refer to as opt-out strategies that do not involve the national insurance carriers? How often do you talk about that with your current agent or consultant?
We don't, I talk at my executive level going, every time we're reviewing prices and they're going up and it drives us crazy. We're like, as an executive, you always ask, is there something else that we can do? Like, why? You always ask the question, why is this happening? Yeah. And then you go through the whole process and, we figure out, is this they give us the option to, opt in without, pricing it out. And it's a negotiation, and, it's one of those things that are part of the business that is just not a fun part of our business. We're trying, as you said earlier, this is a very important part of recruitment and retention. I look at it as like, we've got to fight for the best way to provide the best plans for our team, because that's critical. Not just the price. And I think are we providing them service and confidence? Because when there's a time of need, we don't want our team to be worrying about that. There's a health issue. We want them to worry about, look, their brain is on the health issue. We don't want them to be distracted, stressed, additional work being done just to do the table stakes of getting them confidence that they're covered. So I think that's an important part of just the way we look at it.
Yep. And
we're not going to sacrifice that moment because that's a breaking moment for any employee. That
I understand.
Sure. Maybe the insurance company's not there, but I think also that the employer is not providing that robust plan that provides for them, or the service.
I'm going to share with you a little story in a moment about someone very close to me that had a major medical problem and how my company helped her with that. And I think you'll really appreciate it, because it'll help you understand how these types of opt-out strategies can really improve the experience that your members are having with the health plan in the time that they need it the most, which is what you just hit on. Who is your current insurance carrier by chance? By the way. Not your consultant, your insurance carrier. Is it Cigna? Care First?
Care First.
Care First. Okay. Do you know about how many people are enrolled in your plan?
We're actually doing the rollout today, is actually in our office. I'm imagining we got, I'd say 96%.
Is that like 150 employees, 130 employees?
120, I'd say.
Do you know how many plan designs you offer your employees? How many plans they can pick from at open enrollment?
I think it's 3 or 4.
And off the top of your head, do you know what the deductible levels are on those plans, or at least for the plan where most employees are enrolled? Do they have to spend $1,000 if they go to the hospital, 2,000, 3,000?
I think it's much less than that. Much less. I think it's if I remember, it's much less than that.
Well, that's very generous of you. I'd say the average deductibles we're seeing are probably 1,500 to 2,000 for major healthcare services. So that's fantastic if you guys are doing that. Is there any setup in your current plan right now where members can access free drugs or free healthcare services? Or do they have all the same benefits all the time and they just present their Care First card?
They present their Care First card.
Okay. All right, here's a fun question because this is the funnest part of my job. What would you and Red Peg do if your insurance carrier handed you a check today for $250,000 because your plan ran so well?
That'd be pretty incredible. What would I do? Well, with small business, that's the Christmas present that you never expected, right?
Yep.
That would be pretty incredible, especially with what we spend.
Yep. So I'll just leave you with this thought. Imagine being able to take 5, 10, 15% savings out of your health plan and use that for the rest of your business. Use that to improve the experience for your people. I know you care with all the other things you do. Through the opt-out strategies that we build at Blade Consulting, I'm hopeful that you'll see that we can deliver that type of savings for you, but it doesn't come at the expense of coverage for members. It's actually improving the plan in many ways for members. So I'd like to share that anecdote with you. So someone very close to me a few years back calls me out of the blue and says, I have breast cancer. She's 39 years old. Mm. And that was huge news to me because she's extremely close to me. And the reason that she called me, Brad, is because she knows that my company helps members find the very best providers all across the United States. And so what was most important to her and her family was that she saw an oncologist that specialized in her type of cancer and that they could get that treatment right the first time. So I'm happy to say to you now that I'll call her Jane, is cancer-free. But what we did is we helped Jane find an oncologist at Johns Hopkins that specialized in her cancer. And we shared all that research with her. And Jane had, provider references from her own providers as well. And that's what most of us do. We just ask our doctor, where do I go? But Jane called us. She liked what we suggested for her, and she ended up using that provider. The real kicker is, now Jane was not enrolled in a WellNet, in an opt-out strategy that we build for our clients. WellNet's one of the providers I tend to use for these opt-out strategies. Had Jane been enrolled in one of the plans that we offer, the ones that we're going to talk about for Red Peg, yep, her costs would have been zero for 100% of her oncology treatment. So not only would Jane be guaranteed to see a very high quality oncologist like we hooked her up with, but it would have been completely free for her.
That's great.
And that's the type of experience we're delivering for our clients. When you're in your greatest time of need, cost is irrelevant. It's how do I get better quicker for me and my family? And so the advocacy services that we bundle into these opt-out strategies create a huge uptick in the member experience and support at the times when these people need the care the most. I'm traveling today and I was driving down here listening to NPR. and they said that Americans or the United States out of 11 high-income countries ranks last in terms of cost. And in those other 10 countries that are high income, the lowest income people in those countries can more easily afford their healthcare services than the highest income earners in the United States. And so not only is access a problem, because we have no idea who a quality doctor is, doctors practice medicine. So we want to go to a doctor that has the most practice, just like an attorney. If I have a major lawsuit, I don't want to use an attorney that just got out of just passed the bar. In the same way, Jen didn't want to use an oncologist that's practicing on her. She wants to use someone that has done this, thousands of times. And so through these opt-out strategies, we're able to guide to the highest quality providers, and we're able to heavily incentivize, because in many cases, these opt-out plans are able to negotiate direct pricing with these really high quality providers. I'll give you some more insight into that in just a moment.
So I guess what I would ask, you mentioned a $250,000 check. You said, providing the best care, these consulting services. So where are the savings coming from? Where's the $250,000 coming from? Somebody's not getting $250,000 if that's coming to me. And then if you're saying you're getting the best care and the best doctors, where's it coming from?
Sure. So I'm going to show you a picture in just a moment. I'm going to share a slide with you that directly answers that question. But I need to level set, and we need to talk about something critically important that affects you every day with the way Red Peg is currently set up with Care First. And that fact that we need to talk about is the fact that claim costs drive insurance costs. So the premium that you're paying to Care First has a direct correlation to the underlying claims experience that Care First is experiencing in their plans. Now, logic would suggest, well, if Care First has lower claims, then they're going to have lower premiums next year. You and I both know there's no insurance carrier out there that's trying to lower their premium year after year. And maybe you're one of those lucky companies that got a flat renewal increase from a Care First, or maybe one every 5 or 10 years, you might get a slight reduction. But every year those rates are going up, which to me tells me the claims are going up. Now, I'm going to break that down for you. I'm going to unpack that a little bit. So most companies like you are paying a premium to an insurance carrier, and you're trusting the insurance carrier to lower the cost of claims, to control the cost of claims so the premium doesn't keep going up. But there's 3 huge problems with trusting an insurance carrier to lower the cost of claims. The first problem is a law that the government passed in 2010, the Affordable Care Act. It had a regulation in it, Brad, called the medical loss ratio requirement. Have you ever heard of that before? Mm-hmm. Okay, in super simple terms, it says to an insurance carrier, whatever premium you're charging to Red Peg and all the other companies in that pool of business. So fully insured carriers are governed by a small group pool of business and a large group pool of business within the Affordable Care Act. And it says to those fully insured carriers, for groups of your size, 85% of the premium that Care First charges must be paid out in the form of claims. The insurance carriers are only allowed to retain a 15% margin on the premiums they're charging. And the state insurance department in every state in the US has to approve those renewal rate increases. So Care First has to go to the state and say, here's the renewal premium we're about to charge Red Peg and all these other companies in that pool of business. And here's why we believe we're able to charge that, because claims are slated to go up. And these claims are going to represent about 85% of the premium we're going to charge. So please approve this rate increase. Now, I want you to think about that. I consider that a perverse incentive, because the only way Care First can raise their premium, the only way Care First can earn more out of that 15% margin that they're limited to, is if the whole pie gets bigger. Right. But the whole pie can't get bigger unless claims represent 85% of the pie. So a phrase, lip service, comes to mind. I've been doing this a long time, and you've been listening to healthcare conversations a long time. These insurance carriers tell us day in and day out, year in and year out, how they're doing everything they can to save money. No one's saving any money. Your rates keep going up because the claims keep going up. Proof is, look at the statistics that you get from Care First. It's probably negligible. You're probably getting very little to no utilization information. You have no idea how much claims are being incurred. just blindly trusting that they're controlling it. So that's the number one problem, is this blind trust, because there's this perverse incentive through the Affordable Care Act. You have questions on that? Because that was a lot.
No, I got it. I got it. I know what you're saying. They're motivated to make the claims go up so their overall pie gets bigger.
The second key issue, and I just touched on this, is limited claims reporting. So even if you could figure out different ways to save your company money by reducing claim costs, you're in an insured environment with Care First, where they say it's our way or the highway. These are our plans. This is how it works. And no, you can't do that. You can't do that. You can't do that. Here's what you can do. And again, it's mostly lip service. It's not anything real that's going to reduce your claims. More importantly, though, even if you did reduce your claims, let's say none of your people used the health insurance this year, you're in that pool with Care First. And they want that pool to cost more so they can raise the premium. And that premium increase will still come down the pike to you. It might not be a 15% increase, but they're still going to try and get some fresh premium out of you the following year. The third thing, and this is what I have already touched on and you touched on as being super important, there's no help for quality. In preparing for this meeting, I didn't know who your carrier was, but I assumed it was probably Care First. I went on to Care First website and I looked up oncologists. First, I went on to Care First website to look up for quality. Turns out there isn't any quality on their website, but you can see that for yourself. There's 1,140 oncologists. And if, God forbid, one of your people needed an oncologist and called Care First and said, tell me who the best oncologist is, what they'd probably hear is, you're in luck. There's 1,140 oncologists we can send you to. 10 of them are within 10 miles of your house. Where would you like to go? But that doesn't address quality. That's just saying, look how many we have. And that's part of Care First value prop. We got all these providers, but they don't tell you how much they cost and they don't tell you how good they are. And so I'm going to show you in a moment how to identify the quality of a provider in advance and how to identify the cost of a provider in advance. And in these opt-out strategies, Brad, if you reduce your claims by $100, $1,000, or $200,000, that's money in your pocket. That's money that never leaves your bank account because we showed you and your employees how to pay for healthcare more efficiently, how to be more efficient on the supply side of healthcare. All right, so our families deserve better. You deserve better. Everyone in Red Peg deserves better. We all deserve to be able to find the highest quality providers when we need them, and we deserve to not have to pay an arm and a leg. We're already paying a fortune for the premiums. So these opt-out strategies, in really simple terms, Brad, are level funded or self-funded plans managed by independent health plan administrators, not the national insurance carriers. You heard me mention a company, WellNet. WellNet's CEOs are fourth generation Washingtonian. I use them for my opt-out strategies, for most of them. Okay. So WellNet has all different ways they can be creative to improve that member experience, to improve access to quality physicians, to lower costs for Red Peg, and that allows you to start giving away free healthcare services, free prescription drugs. All right, so to me and my clients, these opt-out strategies are no-brainers, but over the next couple of minutes, as I share some slides with you, I hope that I can prove that to you and at least get you interested enough that you'll take the next step with me, which I'll share with you in just a moment. So I'm going to share a couple of slides with you now that will help round out this dialogue about self-funding or alternate funding, because I don't know how much detail you've ever gone into with these things. And so I'd like to answer any questions you might have. When I say the term self-funding, does that scare you, or is that a concept that you're familiar with and would entertain if the numbers shook out right?
Well, when you say scares you, look, the concern I would have is, how do the costs compare? You say we're going to save $250,000. I think that when you say scare, there's going to be, where's risk mitigation? Like, was there a ceiling? With our traditional insurance, if somebody's got to go in for surgery, a $50,000 surgery, that max is covered with the insurance. Where, when it's self-funding, where's the exposure for the company? So that, when you say scares me, is that's one of the things that like quickly goes there.
Sure.
And then I would also ask about our demographic. Our company skews younger. So I'd say, is there a specific demographic that is better for self-funding than another?
Well, in super simple terms, on the left is what you guys are doing today.
Yep.
You pay a premium. You pay 100% premium to Care First, and you go to bed at night not worrying about a single thing other than how much are they going to slam me at renewal. You don't know how much healthcare your people are using. You don't know anything, but you have no risk per se in the form of claims. You take on zero claims risk. It's all premium risk. In a self-funded scenario, for a group of your size, I'd say that you could expect to probably pay 65 to 70% in claims risk and 25 to 30%, 35% in premium in the form of what's called stop loss premiums. Now, you asked about risk mitigation. Whenever you self-fund your health plan, instead of fully insuring it like you're doing with Care First, companies of your size, companies of most size, regardless how big they are, typically purchase two types of what's called stop loss insurance. And they're not health insurance policies, they're more property casualty type policies. They stop your losses if your losses get too high, if your claim costs get too high. And I've prepared a slide that should articulate that pretty well for us. Okay. So there's two types of stop loss. One is called specific stop loss. And so if you look at this screen, every employer that chooses to opt out and build one of these self-funded strategies chooses what's known as a specific deductible, or it's a claims deductible per person. So Brad, when we build these plans, your people will have an ID card, no different than what they have today. I mean, it'll look a little different because it's not Care First. It'll still have a network logo on it. It'll still have all the same things that providers are used to seeing, your members are used to seeing, and they'll have all the same copays and deductibles that they have today. What I'm referring to here is a corporate deductible, a red peg claims deductible of $75,000 in this example. This means that red peg will pay the first $75,000 of all claims on all members of your health plan. Every employee, every spouse, every dependent is going to have a $75,000 claims deductible. You are liable to pay the first $75,000 of claims. The moment anyone's claims hit $75,000, the specific stop loss policy kicks in immediately and reimburses and pays 100% of all that member's claims for the balance of the year, unlimited. So you're liable for the first $75,000 of claims. The stop loss will pay an unlimited amount, even if it's $20 million. Okay. And then that policy deductible resets each year. Does that make sense so far?
So far, yeah. And you know what my next question is going to be.
I do. And so I'll address that through aggregate stop loss. So if we've now protected you for claims over $75,000 per person, you now have to be protected sideways. Because what if none of your people incur $75,000 or more, but everyone has a claim for $74,000? That would bankrupt a company. And so aggregate stop loss works in tandem with specific stop loss and looks at all the claims under the $75,000. Specific covers everything over $75,000. Aggregate looks at everything under $75,000 and draws a line in the sand. That line in the sand is known as your maximum claims, and it's also known as an aggregate deductible. This tells you in black and white on your aggregate stop loss policy exactly what claims risk exists for red peg for all claims under $75,000. Everything over $75,000 you don't have to worry about. You're only going to worry about the claims under $75,000. And this aggregate policy stops the bleeding at a certain point known as your aggregate deductible or your maximum claims. And that's why this is not an unlimited exposure over here. This light blue box represents your claims risk in a opt-out, level funded or self-funded strategy.
Is there anything, I understand you covered it, the aggregate and the specific. Is there anything outside that there is risk?
Yes.
Where is the risk? Above, is there any other risk that a business owner's got to worry about?
Yes. So I'll touch on two key items. The first is, I'll say ERISA. So right now with Care First takes on all the liability legally of providing a plan that satisfies many different legal requirements. You don't have to worry about anything. You are truly fully insured for your medical and prescription coverage. The moment you step outside of a fully insured arrangement, your plan now becomes subject to ERISA guidelines, not the state insurance department anymore. Self-funded plans are not governed by insurance regulators. It's subject to ERISA. And that does put some onus on your company. Now, when you choose to self-fund, it's very important that you choose a consultant that has experience with self-funding and work with a plan administrator that is willing to and capable of taking in sharing in that risk with you. You can never be fully removed from your ERISA risk as an employer if you're self-funded, but you want to choose a consultant and choose an administrator that can minimize that risk and share in that risk with you. You want to obviously hire someone that's reputable, not a administrator that just started up yesterday. I'd be a little bit concerned. So you are subject to ERISA guidelines. Without going into tons of detail, that's the first thing. The second thing is stop loss policies, like a specific and aggregate policy, are limited by a date range. They're limited in scope. They're not going to cover every claim that was ever incurred for any period of time. They're going to specifically define the period of time of claims that they'll insure. Now I'm going to give you an example. This is a lightning strike, but you asked the question, and so I'll give you the answer. Let's say one of your people yesterday let's say you were in a self-funded strategy. One of your people yesterday got in an auto accident, and the health plan thought the auto insurance should pay, and the auto insurance thought the health plan should pay. And this puppy gets hung up in court for 36 months. And then eventually the court decides that the self-funded health plan should have paid. That's 36 months after that claim was incurred. And in most, or I say many situations, a stop loss policy doesn't capture 36 months worth of claims. It can, but you'll pay a lot for that policy. So I guess what I'm saying is it is possible from a stop loss perspective to capture all of that risk, but you will pay for it. These are talking points, though, relative to stop loss, because every day we choose to get in our car, and that's a pretty dangerous act, but the benefits outweigh the risk. And so when you talk to your consultant about stop loss insurance, they should be able to talk you through this. In other words, if I gave you a policy that covered everything, that you're going to pay a premium for it. And you'll compare what that premium cost is compared to what you believe the risk is of that happening. And you can make a decision. Do I want to pay more for my stop loss so that I can truly sleep at night and have zero claims risk? Or am I willing to pay less in the form of premium and take on a little bit of risk? Because what are the odds a claim's going to drag out for 36 months? So there's two things that I think are good answers to your question. You're no longer fully insured. You do have some ERISA risk. So you want to work with someone that understands ERISA and how to manage that. And there is a possibility that a claim here or there might fall out of stop loss, although they are lightning strikes, and could be attacked through a broader, more comprehensive stop loss policy.
Okay.
Now here's the opportunity. Here's how we save clients money. This is all a variable expense. 65 to 70% of your costs in this environment are variable. If you don't spend them, Brad, that's your money. So think about, earlier you didn't know exactly what you're spending today. But just right now, it's 100% fixed. I'm sorry, go ahead.
No, I'm with you. I got it.
You're all fixed costs today. So just like every other aspect of your business, this is an opportunity to take what is a super expensive, unmanageable fixed cost and turn most of it into a variable expense, which now begs a lot of questions. If this is a variable expense, how do I lower it? Earlier, I was talking.
Encourage a healthier work environment, right?
That's one thing. And you said you have a young, healthy workforce.
Yep.
Very good. Care First isn't crediting you for that today. You keep getting renewal increases. If you're in this environment on the right-hand side of the screen and none of your people use any healthcare, you're going to save a heck of a lot of money. Now, that's not going to happen. They're going to use healthcare. Here's on your screen here, the dirtiest secret in America relative to healthcare. This is how you're going to save money. This is me. This is the tip of the iceberg on cost and quality. Okay, this is the one strategy that we implement for all of our groups because of how impactful it is for families. What you're seeing here is the knee and hip replacement quality and costs in Washington, D.C. You're seeing 5 different hospitals. The orange line that goes from left to right is showing you the quality of the hospital relative to hip and knee replacements. If this was for Jane, my story earlier, we would have showed her the quality of the oncologists at the different facilities. Where you're going to save the money, though, is in this green bar. So this green bar, Brad, represents the average payment made to these hospitals by the PPO networks. This is after the network has discounted the claims using their network agreements and all that jazz. Look at the price differences. The best hospitals doing it for under $40,000. George Washington University is charging 120 grand. That's one medical service. If I'm a Red Peg employee and I need a hip or knee replacement, I don't want to go here. You don't want them going here. If it was my kid, this is why I'm so passionate about this. I want to help you build health plans that foster this environment of caring, foster this environment of advocacy to help families in their greatest time of need. So here's the example, okay? And this is why I asked you if you had big deductibles, and you don't. So this is something I'd want to talk to you further about if we have the opportunity to talk again. I want to make an offer to an employee that's too good to pass up. I want to tell them something like this. Look, think of WellNet's plan as giving you the option of door A and door B. Door A is you self-direct your care. You use that PPO network on your card and you go to any provider you want, whenever you want, and you'll pay the same copays and deductibles with WellNet that you paid last year with Care First. Because these opt-out strategies, I keep saying WellNet. This is the one part of the conversation I'm faking, is that I'm a consultant. I do work for WellNet. So WellNet's plans offer, they're mirrored. So we're giving your people the same copays, same deductibles. That's door A. You self-direct your care. You have the same benefits you had last year. But we're now giving you door B. Door B is where you voluntarily call and speak with an advocate. Let the advocate understand what you need. Let the advocate do some market research, show you the quality of some of the providers around. And if you're willing to use a provider that is recommended to you, that's high quality, Red Peg will pay 100% of your costs. You'll pay nothing. So door A is pot luck. You're crossing your fingers, hoping you're going to have a good outcome, and you're paying your money out of pocket. There's no reason at all why you wouldn't at least make the phone call to door B. Understand who the best providers are around you. And we're going to make it one better for you. If you're willing to choose one of these high quality providers, Red Peg's going to pay 100% of your costs. So for them, it's really that simple. But for you, Brad, this is how the money's made. This is how you're saving money, because if 60 to 70% of your costs are variable, all we have to do is figure out who costs less and incentivize your people for using those providers. And there's this misconception in healthcare that high quality is high cost. That's not the case. Like any manufacturing company, the more widgets I make, the better my widget is and the cheaper my widget is. Healthcare is no different. Sibley probably does a ton of hip and knee replacements, and that's why they do it better and do it cheaper. That's all. So the opt-out strategies that I build at Blade Consulting with companies like you are just fostering this environment of advocacy and empowering employees through big financial incentives. It's what they deserve.
You know, my question to you is going to be, what's the impact on the employee? And your slide you just shared a second ago was, you know, we're already spending this amount of money as an organization. Sure, would I love to save $250,000? That's insane. That'd be awesome. But at the end of the day, am I going to take $250,000 and lose 4 employees, or have 10 of them or 20 of them have bad experiences? No, it's not worth it. The amount of money is not worth the employee impact. So if I'm prioritizing employee impact of like what you're sharing with me, which when I'm walking in this and you're thinking about saving money, initially you go, well, it's going to impact my employees adversely in somewhere along the chain. It's going to hurt them, and that's going to be painful for me, and I'm not going there. So that's just this slide, and what you've explained is, no, actually, Brad, this is creating opportunity to go to the very best. and
Yeah, we can't stress that
good
enough.
money, which is very different from what traditionally you would think of saving money.
Correct. So a question you haven't asked me yet is why isn't everyone else doing this?
Well, yeah, I was gonna say, well, how come I haven't heard about this? Why isn't it much? I mean, why am I not getting, teed up this, or having every one of my other CEOs in my area going, Brad, you guys got to do this. This is perfect. You have a great culture. This is what anybody that's taking care of their employees is going to do something like this. How come it's not, John, why aren't you on CNN and Fox tonight?
Well, I think a couple of things. We're scared of things we don't understand. And so
It's hard to, yeah.
everyone in America is used to doing the same exact thing with health insurance. The big national insurance carriers manage it. That's what your people want, because that's what they think they want, just because they don't know anything else. But I think the more important answer is, this is really hard work for me, man. I could have talked to you about Blue Cross and it would have taken 5 minutes, but this is really hard. I'm trying to convince you. I'm trying to change the world. And that's hard work. And so consultants have to rethink everything they're doing, because even me, going back many years, I used to only think about the national carriers. How could any other company save more money than a Care First? But then you have to dig under the hood. You have to understand where the bodies are buried. How are they making money? And the more you start to look at that supply chain, the more obvious the answers become. The key to your people is, and this is the door A again, I don't want to take anything away from them. I want to give them exactly what they have. I want them to be able to go to whatever doctors they want whenever they want. But like The Godfather, I want to make them an offer too good to pass up.
John, you're saying with this plan, if they wanted to stay with their exact doctors they currently have, that is not a problem, because we're self-funding. They can go to whoever they want. So if
we would still use a big PPO network. So your people would have a big PPO network on their card, just like they have with Care First. We would recommend they use in-network providers, but typically there's a 95 to 98% crossover in all these regions in terms of providers. So it might be possible that 1 or 2 of your people would be impacted, and we can do some due diligence in advance and understand the network crossover between any network we might recommend. And look, anytime there's change, there is some disruption. I'm not going to say there isn't, but we would work through that with you. Ultimately, what we're trying to do, what we are doing with our clients, is building a better mousetrap, a better member experience. And oh, by the way, it's saving you a lot of money, because what we showed on that prior slide.
Sir, I was going to ask, look, the basic question is, why does this make sense versus my current? And you've said saving money, providing our employees more option. And then the last part is, if I said, what makes my decisions? Cost, the value, or you provide me a good, robust plan. Service, are you, going through COVID, we needed a provider that was there helping us through these difficult questions. Look, COVID was a unique experience, but let's go just ongoing service, getting back to us in a timely manner, answering questions. Is your organization able to execute at the level that we're currently experiencing? And I think that's the critical thing for any business owner, is like, sure, value, great plan, service, can you execute? And how do we know that?
How do you measure?
That's to be the key thing.
Some of it's faith, and some of it will be, when the time is right, I'm happy to provide you references that you can speak with, to other employers of similar size, and they'll be able to speak to not only our experience as a consulting firm, but also their experience with these types of opt-out strategies, what impact there was on employees, and how it ultimately resulted in a better environment for everyone.
Okay. Well, thank you.
Sure. So this is the last slide, and then we'll wrap up, Brad. But I leave you on this slide because there's only 3 things that we talked about today. But there's, 16, 17 other things on this slide. And so I've just scratched the surface of what's possible. The biggest decision that an employer has right out of the gate right now, for similar to you, is, do I want to work with a big national insurance carrier, or am I willing to step outside of that and work with my consultant to build my own health plan and manage my own health plan the same way I manage the rest of my business at RedPeg? Because in this type of environment, you have 100% transparency to data. And that enables all of us smart people to sit around this table and figure out how to give away more stuff for free. How do we manage that supply side better? If we know that, even though your people aren't using the hospital because they're all young and healthy, but maybe for whatever reason, they're getting a lot of scans or they're using a lot of this particular medication. If we can figure out how to get those scans to cost less, we can start giving them away free scans to people if they use certain providers. If we can figure out a way to source that drug more efficiently, we can tell members, if you're willing to source it like this, it's free instead of the $20 you're spending now. So we've got all these other strategies. And so I won't talk much more about them now. I just want you to understand that we have a long-term plan, which we can start to talk about in much greater detail once you've made that initial decision to opt out. What I'd love to do for you, if you're intrigued at all by what you've heard today, is I'd love to get some historic data from you and your team and perform what I call a toolkit analysis, which is where we scrub that data and look at every single way we can possibly improve the plan, as I've talked about today, and save you money and the member money. And it'll be very clear to you in that next meeting what the first year might look like in this type of opt-out strategy. There's no strings attached to that. It's just us doing the work, complimentary. It'll take us about 7 business days to build it. And then you and I can sit down again, talk through that. And if you like what you hear there, we can talk about the next steps. Would you be interested in us building that analysis for you, Brad?
Yeah, I think it's been very informative and compelling discussion and presentation. Look, I had very little knowledge of what you guys were talking about. Like, I mean, Keith has talked to me once at a very high level at a cocktail party, and it makes sense now. I think the key thing that we talked about is value, the service, and then the execution is really the biggest. And I think that anybody like me would be saying, okay, who can I talk to that is a current customer of yours that can explain the experience from the employer and also from the employee? That's, I think, the critical thing that we're going to want to hear as references.
Absolutely. By the way, Brad, thank you. You did a terrific job. And as everybody can see, right, this conversation between John and Brad was completely unprepared, unrehearsed. And I have to tell you, both did a terrific job. But I'm curious, Brad, what do you think John did well at communicating? And also, what do you think could be improved as well?
I think really when we get down to the execution part, I think is the one area that I think everybody's going to be, okay, this sounds amazing, right? I get the numbers. Numbers all make sense now.
But how do you execute?
It's going to work for me. It's going to be work. It sounds like the cost works. I understand how I like the slide of like, okay, the risk mitigation. Like that was my going right in there. I knew that was like, that would have been an issue. And then you guys got me there. I'm like, okay, that's great. That checked the box. Then the ability to go to the best for my employees at the PPO and the network crossover is going to be majority to keep them where they want to go. And also providing them the best was a very important, compelling, very compelling. And also your story of 1,100 oncologists doesn't mean you have the best out there, and then, but then it's the execution. So I would go quickly to go, look, we have 150 companies. Here, I'm going to provide you with 5 that have exactly your size employees that you can talk to. I'm going to set up interviews for conversations with you that are willing to talk to you because they're raving fans, not just the employer, but the employees. Like,
no, definitely. That's a great idea.
That's critical for me. And then I think also one thing is demographic. Like, I think you said you have a younger staff. I think you could have gone deeper into that and said, look, wow, you could save even more. You have a younger company. Oh, wow. Like I think you could have gone deeper into that and going like, you're going to save even more than what I was thinking.
Right.
And what Brad is sharing, right, is really important because when you get the CEO or CFO at the table, they don't have a lot of time. And so they're not in the mood for an hour.
Keith, we lost you, but I think it's what he's saying is exactly right. Look, I think you could have gotten right into the points even quicker. although you have the story of your friend with the breast cancer, I think we gotten it right into like the most important thing at that time is the feeling that you are being able to provide the best care. Like everybody says, well, who do you know? Who do you know? Who do I go to that is the very best? And that's what you want. You don't want to go like in plan. Like I want to go the best. I think that's your magical. That's a very powerful point that I think that you could hammer in a different way. Go, look, you put the CEO in that seat. Go, look, it's your wife. She has breast cancer. You want to know you can go the very best. It's not what you screw in like who is the very best I can go to? I mean, put that CEO in that spot, in that emotional moment, as opposed to your emotional moment, put the CEO in that emotional spot.
Good point.
And go, look, now that's you. Now, Brad, think about your employee. Think about one employee, pick about one employee in your head and think about him. And what is he going through when his wife has breast cancer? So you want to provide him and say, don't worry, we got you covered. You can go to the very best.
Totally.
We got out of that old plan that keeps you constrained. We're gonna get you the very best. That's excellent. Magic. I got goosebumps just thinking about that.
Me too.
Right there. That's it. That's magic right there. Boom. You're like,
I think we can do that.
Then everyone like,
and John, let me ask you this: any questions that you wished Brad had asked that maybe he did not? And by the way, that's a great point you bring up, Brad. So thank you.
I asked it in the middle of the presentation, which was, why isn't everyone else doing this? Because I do get that question often enough, and I'll bet had I not asked it, he probably would have asked it later in the presentation.
And we've got about 7 minutes left. And I know we got some questions as well. Just one other question from me directed to you, John, which while Brad is fully insured, right, just paying premium every single month, how would your conversation have changed or any nugget that you would have communicated if Brad was self-funded already?
I would have talked about the medical loss ratios. I would have said that fully insured carriers for the bulk of their business are subjected to those requirements. And that's where they're getting most of their revenue. So the way they think is about how do I maximize claim costs so that we can maximize our premium. But most employers are still using those very same insurance carriers to manage their self-funded health plans. And so to me, it's no wonder why their costs keep going up, even though they're self-funded. That's the key. The national insurance carriers are not in the business of lowering claim costs. They're in the business of recruiting providers and building big networks.
Got it.
John, I also think that 15% conversation, that part of your presentation might have been good on a slide. Just go like, look, quickly, here it is. Here's year 1, year 2. The only way this grows is by doing this, this, and this. Could have been a slide. And I'm a visual guy, so maybe everybody else is like, I don't need another slide. Everybody hates a ton of slides, but it would have helped at a very high level get you through that point quickly.
I had it, but I cut it out to minimize. Thank you for that feedback.
All right.
Bring it back, John. Bring it back. All right, Megan, we have a couple minutes. I see a couple questions in, and I don't know if people are raising their hands as well.
Yeah, I don't see any hands raised yet, but that's fine. You guys can enter your questions in the chat too. I did see a few questions in the chat, so we can start there. This is probably for John or Keith. Does the plan sponsor employer bear any liability for botched procedures if employee takes recommendation and it goes poorly? That's a great question, John.
I'd argue the opposite, because in the case of the plans that we build, the member is provided documented research. So we'd be able to stand behind any recommendation that was ever made. And we're not forcing an employee to do anything. We're just saying, here's the quality that we've uncovered. Where would you like to book your appointment? Now, if pressed, I would make the argument, what would you have done otherwise? Because how else would you have figured out quality? Were you just crossing your fingers? Were you going to go up the street to George Washington University? So you can make the argument that there's some liability when suggesting something to someone, but I'd make the argument there's more liability in not suggesting it. In other words, think of neglect. I mean, if I'm a parent, I have 2 little kids. If I just let my kids do whatever they want, whenever they want, I go to prison for neglect. That's not how it works. And on some level, you have to think about your own employees like that. We should be building plans that help them, that give them support and resources.
Hey, John, this is Dave. Great job, by the way. So in fact, Rachel asked, in contrast to Brad's group, that's very healthy, if you've got an unhealthy group of, like, let's say 200 plus employees that are covered under the plan, how does this work, and how do you identify the savings opportunities in an unhealthy group? Because most people are scared when they say, it's a bad year for us. Would you agree or disagree?
There's two pieces to that answer. One is shopping the stop loss, which is based on prior year utilization. So the stop loss quotes you might obtain in that year might not look all that good. At the same time, as I mentioned to Brad, the right administrator can run a toolkit analysis. We can run a toolkit analysis that shows here's exactly how much money can be saved. Here's exactly how it will be done. And then you would enter into that arrangement with some faith and with some intent. So we're not just going into a self-funded arrangement hoping and praying that we have lower claims, even though the stop loss maximums might be higher than our fully insured options. If we go into it with intent and build a health plan that specifically lowers all of that claims risk, you could very well end up spending way less money in a self-funded environment, even though you went into it with this theoretically higher claims risk. It's case by case still, but you can really dig in with a company like a WellNet and understand what's possible and then make a decision off of that.
And Megan, there's a question about Minnesota and rented networks I see. Would you mind just highlighting that?
Yeah, of course. Just pulling it back up. So in Minnesota, they have primary owned networks by the major carriers, which have to be rented by outside partners. How much of a barrier is this? Another great question.
The variable I don't know, and the answer to that question is, are those networks that are being referenced able to be rented out by independent health plan administrators? Often the answer is yes, but I don't know the answer to that question. So I need to better understand that before I could answer it.
Yeah, and I just add, in most cases, right, we have access to the Aetna network or the Cigna network, and then we can always create a direct contract. Getting, let's say, physician access or any other access has not been a challenge at all. It really comes down, and I think even Shay had mentioned this, right? It's about the stop loss as well. So, how are we handling that? How are we reporting that? And, how are we making, pricing, removing that in essence off the table? And so we do all those things.
But for
We
that
have a great
individual,
question. Oh,
for
go
that
ahead, Dave,
individual,
please.
yeah, for the individual that asked the question about Minnesota, how about hit me directly offline, because I have answers to all of your questions. We actually have a sales representative in Minnesota, and we've done some analysis, and we know everything about cost, coverage, discounts, and everything in networks. So hit me offline and I'll help you with that.
Dave, I put your email in the chat so they can
Excellent.
reach out to you directly.
Great.
And we actually do have one more question that I think would be great to close out. Let me just pull it up. So this is actually for Brad. What do you think was the appropriate next step in this meeting? Was it to get references, dig deeper via a follow-up call, allow them to have access to data so you could see definitive financial metrics?
I think sure. I think parallel paths, like, okay, let's do the financial, the numbers, but at the same time providing references that we can talk to. I think that would be the two things.
Excellent. Well, we're hitting right at 12 o'clock. We have almost a full audience that joined us. And Brad, I have to tell you, you were better than we even anticipated. So thank you for joining us. Great questions, terrific feedback. John, always a great host and, playing the role of broker consultant. And I appreciate everyone joining today. And if you have questions offline, I know Megan collectively is going to email everybody with, some follow-up items. And we look forward to hosting you all again. I believe, Megan, is it next Wednesday again for a round 2 CEO?
Yes, same time, same place, 11 a.m. on Wednesday. And we'll have some good takeaways too that we'll provide before the next session as a follow-up from this meeting. So we'll see you guys next week for another self-funding Shark Day. Brad, you were awesome. Thank you.
Yes,
Take care, everyone.
Take care.